One of the most common questions that I receive in the office is about birth control. What do I use? What's the most effective? What's going to be the best for me? So today we're going to talk about that. Starting off first, we're going to talk about birth control pills, which are the most common method of birth control pills or the most common method of birth control that most women are familiar with. So first we're going to start with Dr. Kenley Newman, and we're going to talk about that today.
So like Dr. Musling said, birth control pills are probably the most commonly used. They're the least invasive method of birth control. They're about 98% effective, but you've got to remember to take them at the same time every day for that effectiveness to be true. There are many different types of birth control pills. There are several that have 7-day placebo pills. There are 4-day placebo pills that often shorten and lighten periods. And we have very low dose pills these days with very low side effect rate. Any type of birth control pill has some side effects and risks, and those risks include heart attack, stroke, blood clots in the legs that can go to the lungs, and potentially breast cancer. These risks are fairly low in these low-dose pills. One of the other methods that many people are interested in if they don't think they can remember to take a pill every day is to use a patch. Ortho-Evra is one of those. It's a transdermal patch, and because of the way it's used, it has a little bit higher dose of estrogen in the body, and because of that, its risks that we've just spoken about are a little bit higher.
A similar method that is gaining popularity is something called the Nuvaring, which a lot of you have been prescribing and a lot of women seem to be more familiar with all the commercials on TV. Similarly, it delivers hormones more in a local fashion, so a lot of women prefer it because it is a lower dose hormone than something like the pill, which would be systemic. Similar to the patch, you do insert a ring, but that stays in place in the vagina for approximately 3 weeks, after which you remove it and you go a week without a ring. During that week, usually you will start your period. So again, you don't have to remember to take something every day, which a lot of women like. I think the limiting factor that I've seen is your comfort with inserting it as a patient, but a lot of women, once you get past that, it's a very convenient option.
What about some of the options that are a little bit longer? So maybe you don't want to change it once a week, or you don't want to put something in once a month. What kind of other things do we have?
Well, we have progestin-only methods, which are also longer acting. So for women who aren't good candidates to have a contraceptive method that has estrogen in it, or are afraid they're not going to remember to put a patch on or take a ring out, Depo-Provera and Implanon are both really good methods. So both of these are progestin-only. Depo-Provera does require you to come in every 3 months for injections, which some women don't mind. For those women who are hesitant about having injections so frequently, the Implanon is an excellent method. It's a small 3-centimeter little bar that we place in the office, and then it works for 3 years. It just goes right underneath the skin of your arm. So with both these methods, you just have to keep in mind about the abnormal bleeding pattern that you may have, but as long as you're patient, usually that sorts itself out after 3 months of use.
I think one thing about hormonal contraceptives too that my patients like to hear is the benefits. Lighter, less painful, more predictable periods, but also because it inhibits ovulation, the decreased risk for ovarian cancer, decreased risk for endometrial cancer. So those are things I like to tell our patients. There are benefits to oral contraceptives besides those associated with lighter periods.
To find out more about the best birth control option for you, call Virginia Physicians for Women and make your appointment today. Experience the VPFW difference.